bringing you the latest updates on viral outbreaks and health advisories from around the globe. From newly emerging viruses to the resurgence of familiar threats, the world is facing multiple health challenges that require awareness and vigilance. Let's take a closer look at the current situation. A newly identified human coronavirus has been discovered in Korea, raising concerns among health officials. This strain was detected following cases involving infants suffering from pneumonia and liver dysfunction. The Korea Disease Control and Prevention Agency, KDCA, is conducting extensive research to understand the virus's transmission patterns and potential health risks. Although the extent of its spread is still under investigation, health authorities are urging the public to remain cautious. Wearing masks, practicing hand hygiene, and avoiding crowded spaces are strongly recommended as preventive measures. Alongside the emergence of new viruses, multiple respiratory illnesses are spreading rapidly. Influenza, respiratory syncytial virus, RSV, and human metapneumovirus, HMPV, are all circulating simultaneously, putting vulnerable populations at risk. Hospitals have reported a sharp increase in respiratory infections, particularly among children and the elderly. To minimize exposure, medical experts advise limiting visits to enclosed public spaces, maintaining good hygiene, and getting vaccinated where possible. Norovirus cases have surged to the highest levels recorded in the past 10 years. This highly contagious virus is known for causing acute gastroenteritis, with symptoms including sudden vomiting, diarrhea, and stomach cramps. Due to its ability to spread rapidly through contaminated food, water, and surfaces, health officials are emphasizing strict hygiene practices. Proper handwashing with soap and water, thorough cooking of food, and disinfection of common surfaces are essential steps in preventing its transmission. Uganda has confirmed an outbreak of Ebola virus disease, EVD, with several cases and fatalities reported. The country's Ministry of Health, in collaboration with international health organizations, is working to contain the outbreak through quarantine measures and public awareness campaigns. Neighboring countries have increased border health screenings to prevent the virus from spreading beyond Uganda's borders. The public is advised to stay informed about the situation and adhere to travel advisories. The World Health Organization, WHO, has maintained its highest alert level for Mpox, formerly known as monkeypox. Despite efforts to control the outbreak, cases continue to be reported in various regions. The virus, which spreads through close contact, remains a significant concern in areas with limited access to vaccines and treatments. To reduce the risk of infection, individuals are advised to practice good hygiene, avoid contact with infected individuals or animals, and follow health guidelines provided by local authorities. The United States has confirmed its first human case of avian influenza, H5N1, in Nevada. The patient is currently receiving medical treatment and remains in isolation to prevent further spread. Health officials are conducting extensive contact tracing and monitoring to contain the situation. Authorities have warned against direct contact with wild birds and are urging the public to report any unusual bird deaths. Although human-to-human transmission of H5N1 remains rare, vigilance is essential to prevent further infections. For the first time in a decade, a measles-related death has been reported in the United States. Health officials attribute this tragedy to declining vaccination rates, which have contributed to an increase in preventable infectious diseases. Measles is a highly contagious virus that can lead to severe complications, particularly among unvaccinated individuals. Health experts strongly encourage parents to ensure their children receive the recommended measles, mumps, and rubella, MMR, vaccine to prevent future outbreaks. Healthcare facilities are facing an alarming increase in cases of antibiotic-resistant fungal infections. These infections, particularly prevalent among nursing home residents and hospitalized patients, pose a significant challenge to medical professionals. The rise of drug-resistant fungal strains underscores the need for improved infection control practices in healthcare settings. Experts recommend stringent hygiene measures, judicious use of antifungal medications, and increased surveillance to prevent further spread. With multiple infectious diseases circulating globally, health authorities have issued a set of preventive guidelines to help individuals protect themselves and their communities. Vaccination remains one of the most effective ways to prevent the spread of infectious diseases. Staying up to date with recommended vaccines, including those for influenza, measles, and other preventable illnesses, is strongly advised. Hygiene practices such as regular handwashing with soap and water are crucial in preventing infections. When soap and water are not available, alcohol-based hand sanitizers can be used as an alternative. Avoiding high-risk areas, particularly crowded and enclosed spaces, can significantly reduce the risk of respiratory infections. During outbreak seasons, limiting exposure to large gatherings and ensuring proper ventilation in indoor spaces are important protective measures. Food safety is another critical factor in preventing the spread of viruses such as norovirus. Proper food handling, cooking, and storage are essential to reducing the risk of contamination. Seeking medical attention at the first sign of symptoms is vital. Early diagnosis and treatment can prevent complications and reduce the risk of spreading infections to others. Anyone experiencing symptoms of a viral infection should consult a healthcare professional immediately. The global health landscape is constantly evolving, with new and recurring viruses posing ongoing challenges. The emergence of novel coronaviruses, outbreaks of respiratory and gastrointestinal infections, and the continued threat of diseases like Ebola and avian influenza highlight the importance of public health awareness and preparedness. By staying informed, practicing preventive measures, and following health guidelines, individuals can play a crucial role in reducing the spread of infectious diseases. As research and medical advancements continue, the global community must remain vigilant in responding to these health threats. Thank you for tuning in to this global virus update. Stay safe, stay informed, and take the necessary precautions to protect yourself and those around you.